Hi, I'm Dr. Melissa, and today we're going to be going over back pain and sciatic relief. Yes! If you have been dealing with glute pain, maybe radiating down the back of your thigh, maybe it goes all the way down to your foot, this is going to be the class for you. A couple things you might want to grab before we get started. If you have some yoga blocks or a tennis ball, lacrosse ball, if you don't have, no worries at all. I'll show you how you can do without. If you are newer around here, hit that subscribe button. If you like the class, thumbs up and leave comments below. It really helps the channel out and I appreciate it. So go grab your things and let's do this. All right, so you've been dealing with literally probably a pain in your butt. Maybe that pain's going all the way down the back of your leg. We're gonna be going over lots of different things today that can help you with that. But the main thing we wanna think about is what is the root cause of your pain? What's driving all the symptoms that you're having? It could be because of your posture. It could be because you're sitting at a different workspace or sitting for long periods of time. I've got you covered. Check out the link down below for my free desk ergonomic workshop. It's got lots of awesome tips in there for you for those things. Lots of things that I work on with my clients. Two most important things to help with low back pain and that sciatic-like symptoms is your breath and your alignment. Breathing might seem boring, but it's super critical that you get your breath down because it's really important to your pain and allow you to move efficiently. So we're gonna start with the breathing and then we'll get into those 5 exercises. Okay, so just find a comfortable position, laying down on your back. If it's more comfortable, maybe you prop yourself up on a pillow with your shoulders or your head, and you're just nice and relaxed. I want you to think of breathing this 360-degree breath out into your rib cage. Keep the breathing out of your chest. Gentle breath. You don't have to take this really big breath in because what happens is you disrupt this abdominal pressure that you have and it puts more stress on everything else. Nice gentle breath in, breathe out into the rib cage, into the back of the rib cage. Exhale, gentle, let it go. Sometimes I have people kind of place a hand at right around their belly button, maybe one on their chest. Gentle breath in. Exhale, letting it go. Good. Let's just take another gentle breath in. Keep it out of that neck and shoulders. Good. So remember, even when we're moving today, breathing out into that rib cage. Breathing is key. And then consistency throughout the day is really gonna help you with that low back and sciatica. Okay, next thing we're gonna do, bring your right knee in toward your chest. We're gonna work on some nerve glides. Your sciatic nerves run all the way down the back of your leg. And you want your nerves to glide back and forth like floss, nice and smooth. So we're gonna bring that right knee in towards our chest, gently straighten your leg, point the toes towards the ceiling, and then bend that knee, pull your foot up towards you. You don't wanna pull it in so much that it's super painful. You wanna ease your way into it. So stop just before you feel that gentle pull. You can do the same exact thing, sitting, maybe you're standing and you just wanna move that leg in and out, or gliding that nerve back and forth to create more mobility. Sometimes it feels like our muscles are really tight, but it's actually our nerves and our nervous system. So powerful combination using your breath and nerve glides. Good. You can do about 10 each side. Good. Now let's switch. Right leg goes down. Bring that left knee in towards your chest and just compare the two sides. Gentle stretch. Bend the knee, pull the foot up towards you, point the toe, bend that knee. Just very easily going back and forth. And this is something that you might incorporate several times throughout your day. Nice, gentle moves in and out. Using that breath. Good, let's do one more on this side. Awesome, let's place both feet back down on the ground. And then I'm gonna have you grab that lacrosse ball, tennis ball. If you have your yoga mat, you can roll your yoga mat up and then we'll do the same thing, or anything small along this line. We're gonna work on our gluteus minimus muscle. That can really reproduce sciatic-like symptoms coming down. So you're gonna find the ball, take the ball, find that front hip bone here, move 2 to 3 inches towards the back, and that's where we're gonna lay. So you're gonna lay on your side, laying on that ball. If it feels too intense, you can always put towels over it. You could put a pillow over it to ease into it. And if you're working more towards the back of that muscle, so those posterior fibers, that might give you more of a referral pain down to your ankle and foot. And then if you roll a little bit more to the front fibers of that muscle, you might be feeling it more referral pain to the hamstring in the back of your thigh. So just play around with those different spots, moving in and out. You'll know when you're on that spot. And with myofascial release, 30 to 60 seconds each spot. Try not to hold your breath and grip. Gentle 360-degree breath and let it go. Gentle 360-degree breath and let it go. Just easing your way into that. And then you want to compare this side to your other side. Good, so let's switch over towards that right-hand side. Same thing, so we're going for our gluteus minimus muscle. We're gonna find that bone in the front of our pelvis, 2 or 3 inches towards the back here. And then we're gonna lay down on that. Remember, the back fibers of that muscle go all the way down to the ankle, and then the muscles towards the front, the fibers towards the front, you're gonna feel back of your thigh. And one side you might notice a really big difference than the other one. And maybe you don't notice a difference at all with either of these, and that's fine. You can find all the other exercises. The 30 to 60 seconds each spot, and use that breath. Good, one more time. Awesome, and then come on off that ball. Great. We're gonna come onto our hands and knees, coming into tabletop. We're gonna work on moving our spine segmentally. So pressing into the palms of those hands, take the right leg, you're gonna send your right leg back, pressing through the heel. Make sure your ribs aren't sticking out, softness through the rib, and just a teeny tilt with your tailbone coming up towards the ceiling. Press into those palms. Here we go for some cat and cows. And at first, just move your spine however your spine wants to move. And see if you notice if there's parts that feel a little extra sticky. And then maybe you see if you can just lift your tailbone. Then can you sink your chest and lift your head, thinking of this wave. Pull your chin in towards your chest, press into those palms, round out, and then maybe tuck the tailbone one more time through. Inhale, lift the tailbone, sink the chest, and then the head lifts up. Good, go at your own pace. Lift that tailbone up, sink the chest, head comes up. And then let's switch, bring that right knee in. Your left leg is gonna go back. Press through the heel, press into the palms, slight little tilts, and then just start to move your spine. See what you notice. There might be certain positions that give you that same referral pain down, or some positions that take it away. Just take notice of those. Good, now we're gonna move segmentally. So we lift that tailbone, lifts up, sink the chest, head lifts up, and then pull that chin in towards your chest, round up, tuck the tailbone. Tailbone lifts, sink the chest, head comes up. Pull that chin in, press, round out, tuck under. Just do a couple at your own pace. Keep pressing out through your back heel, and you're remembering the breath. The breath is key throughout these movements. Awesome. Let's do one more time through. Good. And those knees come back down. Okay, I'm going to give you two options for this next one. If you have your blocks, or if you have a chair, something to hold on to, you can grab those. We're going to take our right leg, scoot that right leg out in front. And just let that right knee sink forward. Your hands can come to the block. You're looking for a gentle stretch in the front of that left hip. Press into those blocks, lift up, really press your right heel into the ground to fire that up. And then maybe you just pull and straighten back a little. Bend into the knee till you feel that stretch. You might have to tuck those hips underneath, drive your knee in the front, and then maybe a gentle straighten out, pull that hip back. Bend into that knee, sink, lift up. One more time, straighten out, pull that right hip back. Good. If this is really uncomfortable, if you're here, keep going through with that. If this is uncomfortable, come onto your back and you can bring your yoga block with you. And we're gonna take that yoga block, you're gonna just gently lift the hips up. If you had a foam roller, you could use that or roll your yoga mat up. So it's right at that sacrum, right below your low back, very comfortable. Bring your right knee in towards your chest, and then you're just gonna straighten out through that left leg, lengthen through your heel so you feel a stretch in the front of that left. I would like you to take 5 breaths here, and then you'll switch to the other leg. Awesome. If you're kneeling, let's switch to the other side. So let's take that left leg out in front, scoot that left foot in between. Drive the left knee forward. Feel a nice stretch in the front of that right hip. You might need to tuck the hips under a little more and see, how does your left side feel compared to your right side? What side is a little tighter in comparison to the side that you're feeling the pain? So it's all about trying to figure out these imbalances. And then maybe straighten out through that leg. Good, bend your knee. Good, and then just straight, use your breath coming in and out. The same thing, you're not forcing anything. You're just very gently moving in and out. Awesome. All right, let's bend through that front knee. Come on out of that. Move those blocks off to the side. If you've got the block underneath, pull it out, come down onto your backs. We're gonna come down onto our backs. So now that we stretched out the front of our hips, we worked on our nerve glide, we've got our breathing down, we're gonna strengthen our glutes as well as our hip internal rotator muscles. So that block, you're gonna take the block and just place the block in between your knees. Our hip internal rotator muscles, they connect your obturator internus, nerding out on anatomy a little bit for you, attaches to your pelvic floor muscles. Really important to help balance everything out. So we're gonna take that gentle breath in, our diaphragm goes down. We've got a slight little tilt in that tailbone. Neck and shoulders stay nice and relaxed. And on your exhale, you're gonna press those hips, squeeze the block, lift up. Just a little lift. And then slowly lower everything all the way back down. Gentle breath in, exhale, squeeze the block, lift the hips. Make sure, the big thing, key here is make sure you're not tucking those hips underneath. Keep that slight little tilt, squeeze the block and back down, inhale. Exhale, press into the feet, lift the hips, squeeze the block. What you're looking for is to feel activation in that lower core. Pelvic floor muscles, lower back down. So follow along at that pace. Inhale, exhale, we press, gentle squeeze and lift. Let's do 2 more. Inhale, lower down. Exhale, press into those feet, gentle squeeze of the block, lift up. Last one, inhale, lower down. Of course, if this is giving you any pain or discomfort, please stop doing this. Lift, come back up. Awesome, and then lower all the way back down. Take that block out from underneath. Let's just take a nice gentle stretch all the way up. Reach through those fingertips, nice breath in. Exhale, let it go. And gently roll onto your side using the breath, that gentle 360-degree breath. Come all the way on up from there. Awesome job. I hope you enjoyed those 5 exercises for low back pain and sciatica. If you're still struggling or trying to figure things out, reach out. I'm happy to connect with you and help you problem solve. I'll put a link down below so that we can connect. If you're struggling with something else, let me know. I'm happy to make a class for you, so just leave a comment for me down below. And don't forget to subscribe if you like the class, thumbs up so that I know, and leave comments. Until next time, I will catch you later. Namaste.